And the sound's running through here for me.
It should be.
Yeah. Good afternoon, everybody. This is Susan McLaughlin. I'm the Executive Director here at HealthierHere, and I want to thank you all for joining us today for a webinar so we can continue to provide updates and share information with our partners as we move forward. So hopefully you all can hear me just fine. If you have any issues during the webinar, we do have people manning the chat room, so just feel free to send a communication. Also, if you have questions throughout the webinar, you can send your questions to our staff as well, and they will respond. So our couple of goals for today, we have about 90 minutes scheduled to spend together, and we want to, first of all, review with you our HealthierHere activities and updates to date. We want to make sure that you have information that you need for implementation planning for the Medicaid Transformation Project, and then we'll begin to discuss the approach and activities that are going to be needed for those of you that are partnering providers that are seriously considering implementation with us in the late fall. So here's just a review of our agenda again. We'll do some updates. We'll roll out our patient-centered approach to system transformation, which is how we're sort of thinking about how the Medicaid transformation fits into our bigger vision of health and human services transformation in the King County region. After that, we'll have time for some questions, and then the second half of the webinar is going to focus on implementation activities and preparing provider organizations for the next steps. So we're getting kind of fancy now, and we're going to try to make the webinar a little bit more interesting and interactive by doing some periodic anonymous audience polling. So here are some instructions on how to do that. So when we come to an interactive webinar poll slides, and you guys may have some experience with this, but you'll see a link at the bottom of the screen, and just copy or type that hyperlink into a separate browser window, and then that should take you to the link where then you can select your response, and then in real time we'll be able to show the results of that poll. So we're going to try that out right now. So this is our first interactive poll. And just to get a little bit more information about who's on the phone. So if you can, again, copy and paste the link at the bottom into a separate web browser, and then let us know what your role is in your organization that you work for right now. Are you part of the executive leadership? Do you work in quality improvement? Are you a clinician? Are you a direct service line staff provider, or another role? And also the link is coming to you via the chat, it looks like, too. So I'm going to just give people a minute to respond to that. And then bring this up, and we'll see. People are still responding. We have a lot more than 10 of you on the phone. So curious, for those of you who are in the other category, maybe you could type in the chat box what your role is, so we're clearly missing some categories, because a lot of you are falling into that. Would like to know who's with us. Okay, so looks like we have a number of individuals from executive leadership, and then the second most majority is people categorizing as other. And do we have, trying to look, so folks from jail, program managers, community engagement, mid-level managers. Okay. Great. Director of Community-Based Organizations. So quite a range of folks on the phone today. Thank you for joining us. We really appreciate it. Okay, so I'm going to start with a few updates. So first of all, we had an all-day governing board meeting earlier this month in April, and one of the things that happened at that meeting is our finance committee made a recommendation to the governing board, and the board approved a distribution approach for our DSRIP Year 1 funds that we earned. So just as a reminder of everybody, we submitted our project application last year to the Healthcare Authority. That was scored by an independent assessor through January and into February. King County received a 100% score on our project application, and as a result, we were awarded $22.7 million in incentive funding, and that funding was just recently deposited at the financial executor for us to begin distribution. And so the Finance Committee has been working on some triggers for funding distribution. So I'm going to skip to that for a minute, and then I'm going to come back to the rest of the updates so people can see, and we're going to talk more about these, but I wanted you to get a sense of the kinds of activities that will be required of providers in order to receive incentive funding from DSRIP Year 1. So completing the current state assessment, and we're going to talk about that today. Completing the partner organization change plan, we'll also talk about that today. There will be some funding attached to the size of the organization for those health and behavioral health organizations that serve Medicaid individuals, and so that will be based on volume, and so that will be tiered levels of payment. There will be a flat rate payment for, so this is not what the board approved. I apologize, this is the wrong slide. So the partnership integration and health equity partnership, those are things that are going to be incorporated into the change plan, which I'll talk about in a minute. So those are not actual triggers. We have a partnership. So another trigger will be partnership participation, and that's just for engaging with us, partnering, coming to meetings and work groups and whatnot. And then signing our partnership agreements will be another payment trigger, which I'll talk more about. And then you'll see right down the middle that we have a specific set aside for our tribal partners. We have 4 tribal partners in King County, and so that they will have similar kinds of activities, but that money will be distributed separately. So back to our updates. Our current state assessment was distributed to partnering provider organizations earlier this month, and those were due back on Monday at 5 p.m. We understand that there are some providers that are still working on those, and we will continue to accept them. So if you are still working on them, please finish and complete it and get it into us as quickly as possible. It's really important information that we will need both for our reporting to the Healthcare Authority, but even more importantly for the development of our implementation plans. So we encourage you to get that done. And that is for health, hospital, and behavioral health providers only. You'll hear later today that we're working on a separate current state assessment for our community-based organizations. The same is true with our health information exchange, health information technology assessments. That was distributed earlier this month as well, and those were due back yesterday at 5 p.m. Again, they went out only to hospital, health, and behavioral health providers. And again, if you haven't completed it and turned it in, please do so. Even though it's past the deadline, we want to get as much information as we can. And that will inform, again, not only our implementation plans, but will help us to make investment decisions around HIE, HIT for our Domain 1 activities that are part of the transformation. Our goal with that is to actually bring recommendations around HIE, HIT investments to the board in June. So we're working on that right now. And then the other update is that our Healthier Here team is growing. We have had a number of new hires and will continue to hire. So we hired a director of equity and community partnerships. Maria Gingrey started with us in that role on April 4th, I think it was. She's been a couple weeks with us, and her primary focus will be a couple of things. We'll be providing leadership to our community and consumer engagement work, engagement with community-based organizations, leading that work, and then she'll also be providing support to us as an organization and to our board around trainings and other technical assistance so that we make sure that we live and lead with our value of equity in the work that we do. So we're really excited to have her on board. We've also hired a director of clinical practice transformation. He will be starting with us on May 7th, and we're very excited to have Michael on board. He will be focused on the clinical practice transformation aspects of our project portfolio. So if you are a hospital health or behavioral health center provider, you will likely be interacting with Michael quite a bit as we think about practice transformation within the clinical setting primarily. And then we are in the process of interviewing for a data manager, and so just finishing those up. Hope to have that person on board shortly. We're also interviewing for a number of project manager positions as well, and expect to have those on board hopefully late May, early June, so that by June we will be staffed up. So exciting for us because there's a lot of work ahead. Okay, and here's our large timeline. Just to remind everybody and ground us, we are in April, more than halfway through April right now. You can see that our current state assessment is in process. We received our incentive payments for our project application, and we're full speed into implementation planning. In June, we will be putting out the master service agreement that all partnering providers need to sign to be a implementing partner with us, as well as our Healthier Here specific agreement for the District Year 1 funding. And so that's the agreement to complete the current state, do the HIE, HIT assessment, and so forth to receive that funding. Those two things need to be signed and completed by June, and then providers will get their payment probably late June, early July. We have a semi-annual report due to the Healthcare Authority at the very end of July. That's our first next big reporting milestone that will come similarly to the project application with scoring by an independent assessor, and then we will earn incentive funding as a result of completion of that report. And then our last big deliverable for this year is the project implementation plans, and those are due to the Healthcare Authority on October 1st. Those will also be scored. And then we will have a second addendum to the master service agreement at the end of the year in the fall for those providers that are going to be implementing providers. And that will be really the contract for the work going forward. That will include the funding for the starting up of the transformation, core investments in training and technical assistance and infrastructure and things like that that are needed. So that is our timeline. Okay, so we wanted to walk you through our latest and greatest thinking on how we're going to be approaching system transformation in our region and where the Medicaid transformation projects fit into this. So you can see the diagram on your screen. I'm going to walk you through. There's a lot here. I'm going to start at the top and remind us of our overall health and human services transformation in the King County region, which is really moving from a system that is crisis-oriented, reactive system that is reactive to health and social concerns to one that is much more prevention-oriented, early intervention and management of health and social concerns earlier on. So we're going to start in the middle, and hopefully you guys can see. Yeah, it looks like you can see my little thing. So we always start with individuals, clients in the center. We have a family, and we know that there's traditional and non-traditional families, and we're working to be able to represent the whole of how families come together for folks. But family and individuals in a community setting. And down here along the bottom, we have kind of what we call the social determinants of health, and a number of community-based organizations that are helping to support families with access to nutritious food and housing, transportation, employment, legal aid, education, and so forth. Over here to the right, we have our healthcare delivery system. So in the far right is our kind of crisis system, where we have inpatient hospitals, emergency rooms, the jail, some specialty care, our crisis responders and police and fire. And then in the middle here, we have our primary care and our behavioral health centers. So I'm going to start there, because the foundational system transformation that we will be focusing on through Healthier Here, it really does impact mostly the community-based behavioral health and primary care. So as you know, one of the goals of the Medicaid transformation and one of the key leave-behinds for Healthier Here is access to integrated, whole-person, culturally responsive care. And that happens here for folks wherever they define their primary location, whether it be a behavioral health center or primary care, and happens through all of the things that are going on with regard to integration, both the financial integration, the fully integrated managed care that's happening right now, and the clinical integration that's really being driven through the Medicaid transformation, the project portfolio. And it includes things like care coordination and introducing into multidisciplinary teams, non-traditional workforce like community health workers and peer support. And it includes the IT infrastructure pieces, like how do we get information to flow better across providers, and how can we work off of a shared care plan. In addition to that, we will be focusing on care transitions. So from our three primary settings of inpatient, psychiatric, inpatient, and jail, some people transition right from those inpatient settings back into the community, and we'll be working to create pathways for safe and smooth transitions back to the community. But we're also aware that individuals sometimes need to use some interim services through long-term services and supports, skilled nursing facilities, or adult family homes, and we'll be working with innovative ways to help transition individuals through those settings back safely into the community. And then one other thing I'll say about the healthcare delivery system and how it fits, you didn't hear me say once the opiate project or the chronic disease project, but what I would say is within all of these settings, we have individuals who are struggling with opiate use disorder, or who have chronic conditions that need to be managed, have a mental illness, and so forth. And so part of the transformation will then be creating mechanisms to identify what a person's needs are, and then create best practice approaches, so that if you're a behavioral health center or a primary care clinic or anywhere else that a person might emerge and they're identified with, for example, an opiate use disorder, that there is an understanding of what is the best practice approach and how do we get that person into the best care possible to meet their needs. And so that will be some of the work of the transformation as well. Care coordination is a big foundational piece of our project portfolio and kind of the glue that ties all of this together, I think, in terms of helping us to be successful. So we will be, even though we didn't select care coordination as a specific project under our portfolio, we will be focusing on care coordination in a couple different ways. You heard me talk about care coordination in the primary care and behavioral health setting and across healthcare delivery settings. We also want to make sure that we have care coordination that stretches into the community and actually comes from the community, and helps us to create those tighter links between community-based organizations and the healthcare delivery system. And that includes some of the same kinds of things that we talked about in the healthcare delivery system: community health workers and peer support specialists, care coordinators, and then the IT infrastructure to link all of that together. We will be making some investments in our community-based organizations as well, again, to help create those linkages to the healthcare delivery system. I'm going to talk in just a little bit about our plans around there, so stay tuned. And then the last thing that we wanted to represent as we think about transformation and what we're trying to do, you can see that there's overlap now in the healthcare delivery system, pieces of it, and the community, because what we're really trying to do, especially for individuals who don't come into clinics or can't come into clinics for a variety of reasons to use care traditionally, which is to bring healthcare into the community and to people where they need it. So that will be another big focus of our work going forward. Okay, so we're going to try our interactive webinar poll number 2. So remember, copy the link into your web browser and tell us where your organization fits into the current system. Are you an acute care setting, a crisis response, a community-based organization, behavioral health or primary care center, or one of the step-down or transitional options? And I will pull this up. So good. So we have a lot of community-based partners and our behavioral health, primary care. Looks like we got all parts represented. Okay, this is great. Nice balance of organizations and representation for the system, so thank you. Okay, I'm going to move, oops, what do I got to do? Minimize. Okay, so moving on. So one of the things that we wanted to start making clear as we go into planning and as providers are organizations are considering whether or not they will be an implementing partner is to start to really talk about what kinds of capacities and infrastructure pieces need to be either in place or at least in thought within your organization in order for you to be successful in the transformation and bridging into the new world. So the first is electronic health records. So as an organization, you should be asking yourself, do we have an electronic health record or not? And if we don't, do we have a plan to get one? And how far along in that planning process are we? Certainly, if you don't have one today, it does not mean you can't be an implementing partner, but you should be pretty far along the way in the planning process. I think some of the incentive dollars can be subsidize or be part of an investment in some of that. It's not going to be enough money to cover, of course, the cost of electronic health records. So your organization has to be ready and prepared for that. Having registry capability and capacity that links to electronic health records is another piece in order for us to have a more population health approach to managing chronic diseases and other illnesses. The registry functions become really important. As well as other population health management tools and knowledge. Multidisciplinary teams. Have you as an organization been thinking about this? Who would be part of that multidisciplinary team? Are they in place already or not? And for those organizations who don't provide both behavioral health and primary care, what is your plan to link to the primary care partner or behavioral health partner so that they can be part of that team? Doesn't have to be on site per se, it can be more of a virtual connection. Evidence-based approaches and quality improvement. Do you have experience implementing evidence-based approaches and doing, small-scale quality improvement, PDSA kind of cycle to that? What kinds of evidence-based approaches are you already doing around which populations or which chronic conditions? Do you have capacity to do measurement and provide outcome-oriented care? And this includes, both in the form of treat to target, as well as using validated instruments and measuring them over time and adjusting care as needed based on whether or not an individual is improving or not. And then what kind of capacity do you have today to do a more holistic, whole person screening for strengths and assets? Is that something we ask about and gather at any point in time in care, as well as medical vitals, mental health, substance use disorder needs, oral health, pregnancy intention, and social determinants of health, and what those needs are? Do you do any of those things? Do you do some of them? How do you do them? Where does it happen? At what point in the workflow or in care does it happen? So as we think about how the Medicaid transformation can help and where Healthier Here as an ACH might be making core investments, they kind of fall into 3 buckets. So there's training, technical assistance, and practice coaching. And if you look kind of at the range of our portfolio and the goals that we're trying to accomplish, some of that will occur by way of community-based care coordination. Do you need technical assistance or coaching on team-based care and how to do that, or how to bill for that, how to code for that? Treat to target measurement or measurement-based care. Standards of practice, both for care coordination, but for other aspects of care as well. So some of the best practice approaches that are defined in the toolkit. Information technology, that's another kind of core infrastructure piece that organizations need. And so we as a ACH will be making investments in technology that will help support shared care planning across providers and provider types to create interoperability so information can flow. Client registry capacities. I mentioned earlier that some dollars could go to helping support getting providers that are still on paper records onto electronic health records. We could invest in system-wide technologies like telehealth or e-consults as well. So those are some of the things that are under consideration. And then in terms of workforce, in addition to the training, which will be a big part of our workforce strategy, will be training providers on the skill sets and the practices that they need to deliver care differently. We'll also be focusing on workforce capacities, particularly around the areas of community health workers and peer support specialists, and then care coordinators in general. And we'll be investing here with an eye towards how do we build those capacities within our region, and how do we create a pathway towards sustainability for those workforces in value-based payment arrangements. So we'll be looking as we think about those from those particular lenses. Okay, and then a bit about our plans for engagement of community-based organizations. So if you've joined us for other partner summits, you've seen this slide before. One of our main goals for our system transformation is really building this strong bridge of bidirectional partnerships between the healthcare delivery system and our community-based resources and organizations that are addressing the social determinants of health. So here are some examples of community-based services that kind of link and connect to the healthcare delivery system or support health. One of the challenges that we have here in King County, it's one of our blessings and our curses, is that we have a lot of organizations, community-based organizations, that are really filling an important role of addressing social determinants of health, and they're an entry point to care. Sometimes they're the only place people feel comfortable going to and receiving care, and so they're a critical piece to all of this. At the same time, there's a lot of them. We know that there's over 500 nonprofit social service organizations in the King County region, and of course, we cannot fund everybody, or everybody would get about $12.50, which can't help so much with transformation. So one of the things that we have to do is figure out how we're going to structure some parameters in how to engage community-based organizations and which community-based organizations should be engaged with us and can help us make successful transformation. So here's some examples, and I just want to kind of reiterate and point out that these are, nothing has been decided yet. We have a Community and Consumer Voice, which is a formal committee of our board that we will be working in partnership along with some of our other social service organizations like the Human Services Alliances and stuff will be coming out to have further conversation about how we best define parameters for identifying community partners for system transformation. But these are some of the things that we've been talking about and thinking about. So first of all, does the organization serve a population that is part of the focus population for HealthierHere? And so that includes, you know, do they serve Medicaid clients at all? And if so, how many? And are they clients within the needs that are identified through our portfolio? What types of social services does the organization provide? And that becomes important from the sense of what are the types of social services that need to be linked to the healthcare delivery system through our portfolio right now in order for us to be successful in achieving the outcomes that we're trying to achieve. Do organizations have existing formal relationships between the healthcare providers and those community-based organizations, and what are the natures of those relationships? Do they provide unique services to either high-risk or at-risk populations or underserved populations? So again, really recognizing that there are a lot of communities and individuals who don't come into traditional care for a whole variety of reasons, but might come into a community-based organization, especially if it's one that is a match to their particular race or ethnicity. And so that could serve as a way for us to bring healthcare out. And then do they provide services, or how do they link to our specific portfolio and the metrics that we're accountable to? So those are some of the questions that we'll be thinking about and asking in order to come to the right pool of community-based organizations that can help us with this. We will be having a separate community-based organization current state assessment, just like we did for the health and behavioral health providers. We are still in the process of drafting that current state assessment. In the one that went out to the health and behavioral health providers, we did ask specific questions about what community-based organizations they currently partner with. And we'll be asking similar questions for the CBOs as well. And then based on all the information we get from the current state assessments from all of our provider types and the parameters that get developed, we will again, kind of seek to engage some subset of community-based organizations to help support our transformation goals going forward. So for our next interactive question for you guys, what do you see as the biggest barrier to successful partnerships between the healthcare delivery system and our community-based organizations?
Susan, and while people are responding to that poll, there's been a question that's come in through the chat, which is, can an organization qualify for payment under both behavioral health and as a community-based organization?
Great. So the answer to that is yes. Yes. The answer will be yes, and again, within the parameters as we define them, but we're very aware that there are a number of organizations that do both. And so when we get into thinking about change plans, that will be a place for those provider organizations to really think about how they're bringing those things together for implementation. But for this first part, if you do both, you would fill out a current state assessment for your health or behavioral health book of business and the separate one for the CBO, and can receive payment in both of those realms. So this is great. So it looks like technology, the systems not talking to each other is one of the biggest barriers that's being identified, and then lack of funding as well. And I imagine that's time and capacity and funding to have the ability to do that, to spend time on that. so our next steps for our community-based organization engagement, is there another question?
Yeah, I think this is a good question to ask out loud as well. This is regarding CBOs and how you mentioned that CBOs would be chosen based on how they can address specific project metrics. Mm-hmm. Have those metrics already been identified?
So the metrics, the metrics on the healthcare delivery side, yes, those are prescribed in the toolkit that was developed by the Healthcare Authority and attached to our project portfolio. I didn't put that slide in this deck, although if you go onto our website and look at previous decks, it's been in a number of them. You'll see it's a grid that outlines the specific metrics that are part of our project portfolio and what projects they tie to. You can also find the whole toolkit that lists all the metrics on the Healthcare Authority, Healthier Washington website as well. We can actually push that out too when we send the follow-up slides. Is that the only other question? Okay, great. Okay, so our next steps are to do the work that I was just talking about with our, through our committee, our Community and Consumer Voice Committee, work on, and with other community-based organizations, working on developing those parameters, identify those partner organizations for engagement and implementation, finalize and distribute the community-based organization assessment, and that will go to a subset of partner organizations, not to every organization, again, as we define. And then we will work on the development of an engagement strategy and figuring out those pathways and how to start building those bridges between the organizations and the healthcare delivery system. So timeline for that, probably people are wondering in their head. I'm guessing that the community-based organization assessment would probably go out sometime in early June. Okay, so we're going to take a pause here before we move into the next section and just see if people have questions. I know there's been some back and forth already, but if there's other specific questions that you want us to tackle, please send those in the chat room. Okay, doesn't look like there's any questions right now. So Teresita has her hand raised. Teresita, good for you. I don't know what to do with it, but can we have a way for her to talk?
No.
No. So Teresita, can you type your question into the chat? Oh, sorry. You're quick. Is oral health considered part of primary care? Can you say more about what you mean by that?
Could do is we could just move on and we can take that question as it comes.
Okay. So send us more information about Teresita, if you could, please, about specifically, and then then we'll come back around to that. Okay. So preparing for implementation. So I talked about the current state assessment. This is an important deliverable for us as Healthier Here. It's one of our core deliverables to the Healthcare Authority due at the end of June. And the purpose of the current state assessment is a couple of things, besides just being a deliverable, because that's not a good enough reason to just do something, but we want it to be useful to us and useful to you guys as provider organizations as you're filling it out. It's really about understanding kind of what the current state is in relationship to both the infrastructure capacities that are needed, as well as the approaches, evidence-based approaches that we're required to do in the toolkit, where providers are at and how ready they are to embark in these system transformation activities. And we will aggregate that information as a region and report that. It will help us determine the level of engagement for cohorts of providers, because as you can imagine, some providers are going to be more ready than others. And so we will be engaging with them in different ways in terms of the types of investments that are needed to move forward. And then the results will also help us make determination about our investments, particularly around Domain 1 investments system-wide, as well as develop our implementation plans, which are due in October. And so for those of you that don't know, we have to develop very specific, project-specific implementation plans even around each project, with specific milestones and activities and a timeline for those things. So we will use that to inform that. So you can see in the middle, the general topics that are covered include, cross-cutting activities as well as very project-specific questions. We have, there were 3 surveys that focused on different provider types. A survey that was directed at hospitals, one that was directed towards federally qualified health centers, and the other directed towards behavioral health centers in our community. And again, you can still turn those in if you haven't, and completing that is one of our payment triggers. Same with the HIE-HIT assessment. This has a little bit different objective in that it's really looking at the information technology needs in our region, both with regard to everything from do you have an electronic health record and who's the vendor, to how do you share information, can you share information across provider types, and then it asks about registry capabilities and whatnot. And that was one survey that went out to all hospital, federally qualified health center, and behavioral health organizations. And this one in particular, we were able to coordinate with one of our ACH partners down in Pierce County, so that organizations that are in both Pierce and King County only had to fill out one. I'm sorry we couldn't get there with some of the other assessment stuff for those of you that are in multiple regions, but we are really trying to coordinate across regions to have as limited burden on those providers that cross regions as possible. And then the last thing that we've done since we've last spoken is we've launched some implementation work groups. We reconvened on March 19th individuals that were participated on design teams last year, specifically design teams that are connected to our project portfolio, as well as the invitation went out to any provider that had indicated on our provider survey that they were interested in participating in one of the projects. So we cast a pretty wide net for that first work session. It was a half-day work session that happened in March. We probably had 80 to 100 people in the room. We had everybody together for part of it, and then we broke up into project-specific groups with a particular focus for that session on some advanced thinking that we've done around populations and the population approach that we want to use for our transformation, as well as kind of a revisit and validation of the evidence-based approaches from the toolkit that we were going to move forward with, and making sure that we were able to commit to those as a region and what the implications of those would be. We got some really great feedback. Some great work happened during those conversations around both how we think about our populations and our evidence-based approaches. And it ranged from everything, like there's a lot of questions. Our public health and DCHS partners who are doing all of our data are able to produce some really great information for us about our population and our regional health needs. I think what people are looking for most is continued disaggregation of the data, breaking the, not rolling up our race and ethnicities into such high-level categories, but being able to break that down, include other populations that aren't included, such as the LGBTQ population that's not called out, and how can we look at that and look at the data in different ways as we move forward with this. So some great work is happening, and so our next, our implementation work group session is going to happen in May, and I'll talk more about that at the end. But what I want to say is that this is a critical pivoting point for us and for ACHs in general. Here at Healthier Here, we have cast a fairly wide net up until now with regard to our partner engagement. Last year, we had large learning sessions and invited everyone to be a part of our design teams and thinking about what our regional health needs are, what transformation should look like in our region, what great project application ideas would and should be. Obviously, we had an excellent project application thanks to everybody. And now we are pivoting really into implementation, and this is kind of where the rubber hits the road and where we have to take these great ideas and then operationalize them at a provider organization level so that, we're really looking to those organizations who are ready to commit to moving forward and actually working on implementation. So as we move into the May meeting, we're going to be much more focused on those providers that will be implementing providers. That's not to say everyone can't come, everyone can come, but we're really going to be drilling down to what does it mean to be an implementing partner, what's going to be required of me, how am I going to get paid, what is the timeline and the activities that have to happen between now and the end of the year.
So if I can interject, this is actually probably a good time for one of the questions from the audience is, how do community-based organizations who have community health workers and are not part of the primary care system, for example, no EHR, may not have necessary provider capacities, how do they become involved with patient navigation and care coordination?
So that is a great question. So right now, my recommendation is to, and at the end of the slides, and actually Melissa can type in the chat box, contact information, connect with us if you aren't already, so that we know that you're out there and that you're interested in this. And as we start to sort of develop those parameters and think about the types of organizations that are going to help us be more successful, we will invite you into those conversations. And it will be at those tables where we start to answer that exact question that you're asking, which is how do I be a part of that? What might my role be? How can I help in service to this? So most important thing right now is get us your information, so that we can include you on those conversations that are to come.
And then I also just wanted to point out, Teresita had followed up with more detail on her question. So she's asking regarding oral health services, do you count oral health services when you look at at primary care services? Oral health was referred to in the slides. This is important for diabetics and people with hypertension. Also, high use of ED services for toothaches.
Yes. So thank you, Teresita. I appreciate that question. We do, and it's been our intent, even as we didn't select all of the projects that were available to us, oral health being one of them, to try to figure out how to integrate that into the integration work, not to be punny, but that we're trying to do. So I think we have some work to do on that and on setting expectations. That's why I think these next couple of work sessions, as we define with our implementing partners what that's going to look like and how we start to operationalize what it means to participate, that those are the kinds of questions that we'll sort with. I know that we have had, there's a lot of interest from the Arcora Foundation. I've had some conversations with them. I hope that we can continue to kind of think about where does this fit and how do we integrate this in. So we are digging into, I know Eli is also digging a little bit deeper into the ED visit stuff, and that will be another telling part for us when we can actually see like what percentage of ED visits are related to oral health issues and whatnot too, as we think about how do we hit our metrics.
Okay, and then here's another question in the chat I think is relevant to everyone. How will you select prospective implementing partner organizations?
Yeah, so the way we're thinking about this, specific to the health and behavioral health in particular, once we get the current state assessment information in, what we are likely going to do is kind of sort out some cohorts based on where folks are at, their readiness and capacities and needs, and then we'll work with them kind of separately but together in parallel tracks around how we do investments and what the timeline might look like. So our intent is to include everybody in that tent for the most part in some way, shape, or form, but our investments might look really different depending on organizations and where they're at and what their needs are. When we do system-sponsored trainings and things like that, everybody will be invited. We want everyone to benefit from those kinds of things, you know, because even if you're not totally ready and don't have the capacities to get trained on, you know, for example, the collaborative care model, there are pieces of it that can start to be implemented even as you're building some of the infrastructure. So system-wide kinds of activities will be invited, you know, within the parameters of how we're setting it up, and then direct investments will depend, and we're going to try to sort folks into cohorts. Thanks for the question. Okay, so this is what our Medicaid provider organization landscape looks like right now. There's 12 hospital systems with 18 unique hospital campuses in the King County region, 7 community health centers with 35 plus unique clinics, and then 25 direct contracted community behavioral health centers under the BHO, the Behavioral Health Organization Network. And in addition to that, there's a consortium of 27, I think about 27 smaller providers. So they count as one for our purposes, but I wanted to make sure everybody can see where they're being counted in this. And so this is sort of the landscape of our target. You can see kind of in terms of engagement. And engagement here is defined as completed the survey and register in the portal, basically. Okay. So these are our so the missing organizations are ones that have not registered with us completed our provider survey and gotten registered into the portal. And we're working on those that aren't there right now. So as you think about your readiness for implementation and engagement with us, it's important to kind of remember the opportunity in front of us. So I went through the kind of our vision and where the transformation fits in. We will be very much focused on sustainable system transformation, and at the same time, we will be doing small tests of protocols and approaches that are currently not reimbursable through Medicaid and other innovations. As you think about where you need to get to, think about the state's Healthier Washington goals and the goals under the Medicaid transformation, which are really about providing whole person care and being able to function in a value-based payment environment, and the capacities and infrastructures that are needed to do that. Things like data and technology, relationships with other sectors, adoption of evidence-based practices, and then being able to do measurement and performance on certain quality metrics. And in one of our previous summits, we had some slides that were put together by Manat when they were consulting with the state that lays these out in even more detail. If you haven't seen those, we can make sure that slide gets out as well. And again, this just in a graphic way sort of, again, outlines an earlier slide about what you need to be thinking about, do I have in place or not, and the technologies at the patient care level. And these technologies are important to achieve what we're trying to achieve, which is better care coordination, especially for our complex patients, the delivery of quality care through best practice approaches, and then at the patient care level. And so these things, electronic health records and registries and multidisciplinary teams are the sort of the pieces to help with that. But the other thing to keep in mind is that at the organizational level, that we have to have an eye on population health management, continuous quality improvement, and then system performance, because as the payers move more towards value-based payment arrangements, there will be quality metrics that have to be met in order for payment to come. And so it's really about building the infrastructure and the capacities to do those kinds of things. So healthcare organizations, health and behavioral health in particular, need to be thinking about, do I have these things already? If not, have I been thinking about them? Where are we on the continuum of getting them? What do we need to get them? And this should not be new. If you've completed the current state assessment, it should be along the lines of the questions you were answering for us about where you're at in that. So we have another interactive poll here about your provider capacities. So when you get into this one, you can check all that applies. What are the things that you have in place, and what are the things that you don't? Okay, so it looks like we have a lot of organizations, and this doesn't surprise me one bit, who have a lot of the core capacities in place and are ready to move forward. So that's very exciting for our region. And in the areas where there are holes and gaps, and for particular providers, again, these are the areas where we want to be able to help support and make investments. Great. Look at a lot of you have outcome-oriented measurement stuff in place already. That's terrific. Okay. So, again, preparing for implementation, there's the operational readiness. That's the things that we were just talking about. The infrastructure pieces, what's in place, what's not, what kinds of workforce policies are in place. It's not something that we've talked about. It's something that actually in year 3, 2019, we will have, ACHs will have some responsibility around some standard policies and guidelines system-wide. So I'm thinking about that. What kinds of contracts, agreements, informal or formal, do you have with community-based organizations today and other agencies that address social determinants, and data sharing and data use agreements as we start to think about information flowing across providers and provider types. In terms of clinical readiness, again, thinking about what do we do out of that laundry list of holistic screening, how many of those things do we touch and address? What evidence-based approaches do we currently use and do? Are we using them well? Did we do a training and then just kind of leave it? Is there a need for a refresher? How do we triage patients who have complex needs? That's a critical one for the population health management. How do we do care coordination in our organization? Again, this is another thing from the current state assessment. And what are our approaches to getting people to the social determinants of health? Do we have health teams, multidisciplinary teams? If so, who's on them? What are their member roles and responsibilities? And then what kind of training and coaching do we do? What's our quality improvement process? Do we have one? And how do we do performance measurement? So the other thing that we have been challenged by, and we just want to put on the table, and folks on the phone might have some thoughts about this too, is who needs to be engaged, and it might be kind of who needs to be engaged and when, because there's multiple levels of this, and we want to continue to sort with the goal of getting the right people at the right table at the right time to move things forward. So we think that there is a need for executive level engagement within organizations. Whether it's the CEO or the executive director, the chief financial officers and chief medical officers for some of the finance and system performance kinds of work, as well as the signing of the agreement and committing the organization. There's going to be a need for quality improvement staff to be involved, whether it's a quality improvement officer, a physician chief in hospital or healthcare systems, if you have a quality improvement specialist or other program managers, who's responsible in your organization for making improvements and doing that change management and making sure that there's some kind of quality assurance process. And then there's the need for direct service providers, people out there actually delivering the services, physicians and clinicians and social workers and nurses and case managers, because if this doesn't work for them, it's never going to work. And so we need to continually, as we think about operationalizing this, make sure that we hear, get a reality check about how will this work with workflow and processes and on the ground and the delivery of services. Isn't it going to add burden or simplify and make things easier? What would be the impact to the client that's sitting in front of the direct service provider, and so forth. So there's lots of roles and scopes, and we'll be looking to our partners to help us sort and get the right people at the table at the right time. So at this point, our next step is really, and we'll be working through our formal committees and the implementation work groups, so that hopefully by the May, maybe Partner Summit will maybe have a draft, but by June for sure be able to lay out more clearly, like if you're an implementing partner, here's specifically what you're going to be required to do, and here's the metrics that you need to help us move the needle on, and here's how you're going to get paid, and start to sort of flesh that out for those of you as you're trying to think about what does this mean for our organization and how do we think about this. But I wanted to just start by reminding people and laying at a higher level so that you know what commitment means and looks like from our perspective. And what it means is a commitment to meet the parameters of Healthier Here and our project portfolio, what we've selected, and the practices that we've selected, and the Healthcare Authority toolkit. Okay, we are bound by sort of the structure of the toolkit and what is laid out, and that includes implementation of the specific evidence-based approaches that are named in the toolkit and specific focused populations that are both named in the toolkit and then further defined and refined by us here at Healthier Here. Now, that doesn't mean that there's not room for innovation or that everybody has to do only the specific model detailed out in the toolkit, but we do have to implement and report on core components of those evidence-based practices. So you really, as you think about, for example, if you're going to participate in, what's a good example, one of the chronic disease projects, that you look at the toolkit, you look at the project application, and you say, okay, I have a large population of individuals with chronic respiratory diseases, and so I need to make sure that as I think about transformation for my organization, that I'm thinking about it through the lens of the evidence-based approaches that are outlined in the toolkit. The other thing that partner organizations are going to have to commit to is to help us improve outcomes along the required metrics. And so somebody was asking about, do those metrics exist somewhere, and the answer is yes, and we will send that out for those of you that might be joining for the first time to this group, so you know what that means and what that looks like, because we have to, as you remember, this is incentive funding, it's not grant funding. We only earn money for the region if we move the needle on the metrics. So it's important that we have our eye on that. Although we don't limit ourselves to those things, we have to have our eye on them and be mindful of the work that lies ahead. And then the last thing that providers will need to commit to is fulfilling all of the required reporting requirements from Healthier Here and from the Healthcare Authority. So you'll recall that the financing structure of this is it starts out pay for reporting, and it ends up on paying for performance. And so over the next 2 years, providers will get paid for participating with us by fulfilling reporting requirements. And so here is a draft. This is just a draft, so don't panic too much, although it's the most recent draft, of where the state is at with some of the potential reporting metrics going forward. So for example, if you are participating in bidirectional care at the practice or clinic site, you will need to report at some level in some way on some kind of assessment of integration of physical and behavioral health care. And so it could be, for example, completing a MEHAF self-assessment tool every 6 months. It might be something different. That's not set in stone, but you need to be prepared to do that. You need to be prepared to report on what providers, how many providers, when were trained in your organization on the guidelines for prescribing opioids for pain. That's part of the transformation and so forth. You can see some of the other ones there. Reporting on by organization site, connecting for community-based organizations, connecting persons to individuals to medication-assisted treatment if they have an opiate use disorder. So again, by May or June, we hope to have this even more specific along the lines of the toolkit lining up to the state requirements, where again, it's a sort of back and forth with the state to getting to those final requirements, but we're committed to getting as much information out to you guys as possible so you know what you're working with and have an understanding of what it means to commit and work with us. So then the next thing down the line for you guys as providers is the change plan. So we've talked a lot today about a lot of pieces, a lot of things that need to be in place, a lot of commitments and requirements. Our deliverable to the state is, as I mentioned earlier, implementation plans for each of the projects that detail out what are going to be, who are the implementing partners, what are going to be the specific activities that are going to happen by milestones and timeline, who's going to get trained, how many trainings will we do, when are we going to do those trainings, those kinds of things at that level of detail. We will be working through the work sessions, the May and June work sessions, with implementing providers to sort of build out a high-level system implementation plan, and then based on that and how we develop that, we will then build a simpler kind of template for partner organizations to then take that back and think about what does this mean for us as an organization and what is our change plan going to be. So really we're trying to help you guys bring the right people within your organization to the table to think about what is transformation going to look like for us, and where do we align with the Medicaid transformation, and where are we willing to commit to partnering along the lines that I just described. So I think I just said this, but the next couple of steps are the implementation work groups, developing the core components of the system level implementation plans, identifying what training, what technical assistance, other domain one capacities are needed, what the timeline is going to be, and then based on that general framework, we will have a template for organizations to complete to develop their change plan within that framework. And then again, remembering back to the payment triggers, you will earn incentive funding based on completing the change plan, just as organizations will for completing the current state and HIE assessment. All right, so complete your current state assessment and your IT assessment if you haven't already. Start thinking about, if you haven't already, within your organization, your readiness to be an implementing partner, what capacities you have in place and what you're going to need. I strongly, if you haven't done so already, I really encourage you to identify internally within your organization kind of your transformation point person around change management, and then convene bring together kind of all the partners within your organization that are going to touch this work. So finance and contracting, and then the clinical people attached to the different threads. So if you have, if you have a significant population of individuals with opiate use disorder and you want to put energy there and be a part of that, bring those people together. If you're going to be in all four, bring all the sectors together and start to have conversations, because again, this isn't about standing up for different projects. It's about creating transformation within organizations that's sustainable. And so trying to align the infrastructures and the technologies and the workforce and the other pieces that are needed, and then preparing those, the individuals, so that if you have somebody with a chronic disease or an opiate use disorder or mental illness that come in front of you, what do you do? What is the best practice approach? And then building those community-based relationships. So starting to think all of that through. Hopefully the materials today helped to, give you some outline or some ideas about questions you need to be asking yourself about this. Our next partner summit will be on May 17th. It's scheduled from 2:30 to 4:30 right now, and more to come on whether or not that will be in person or webinar, and we're definitely open to feedback on that. We're trying to be very mindful of the amount of time commitment it takes to engage with us and the burden that is putting on providers, and trying to find the right level of getting information out to as many people as possible, like today through a webinar, and then getting the people, the implementing partners on the ground face-to-face to really be doing kind of the nitty-gritty. So we continue to be open to feedback and thoughts about how that's working and what's working and what else we can do, if you have ideas about that. On May 7th, we will be having our next half-day work session. And so again, I want to encourage, if you are seriously considering being an implementing partner on any of the 4 projects, especially from the behavioral health lens, to get the right people to that meeting for planning, because we're really trying to pivot to operationalizing all of this so that providers can start to understand what it's going to mean to sign a contract and engage with us. All right, so our last interactive poll for today is, how are you feeling? I think we should have totally overwhelmed, and no, just kidding. How are you feeling about your path to becoming an implementation partner? Do you feel great and ready to go? Good, and you're making steady progress within your organization, or you need more information and guidance, or you're unsure? And again, if there's specific information or guidance that you think that you need that we're not covering, send that to us in the chat box, and we will make sure we get information out or cover that at our next Partner Summit.
Just a comment here about requests to send out the details of when and where the May 7th, the next Partner Summit is. If you are registered, you are in our system now. If you haven't, if this is your first time registering, you'll receive a follow-up email with a link to the webinar, as well as registration link for this and future Partner Summits.
Thank you, Gina. Are there any other questions that people have? So we are, any other comments that anybody on the team here wants to make?
We will be sharing the slide deck. It's one of the outputs from the meeting today.
So we have several things and this will go out tomorrow. Tomorrow in the morning, you should see a follow-up email from us that will include the slide deck, will include the metrics grid, we'll include the link to the provider survey if you haven't completed that. This webinar was recorded, so the link to the recording of this webinar will also be included in that. And as always, and on the back slide is our contact information. Please do not hesitate to reach out to us at any time with questions, thoughts, or feedback. So we still have some chat going on, so we'll keep it open here for a little while for any lingering questions or thoughts. But thank you all very much for your time. Really appreciate it. So there is a comment, I'm just going to kind of read because I don't think everyone can see this, about sending out as soon as we know the reporting requirements. We definitely will do that. We just got the next draft, which I shared with you yesterday or Monday, and it's a draft. They're taking feedback right now, and they're piloting it with a couple of organizations. So we definitely expect that we'll see a different iteration. As soon as they're finalized, we will push that out. And there was a question about the need to create different reporting structures, and we will also are thinking about that, and we'll be working with providers around how to report on the things we need to report on. So it looks like we've responded to everything that's come in. So at this point, I'm going to just close us out and say thank you again. We really appreciate your time and participation in this webinar. We hope it is helpful, and we look forward to doing it all again in May. I'm sure we'll see you all sooner than that. So thanks very much.